We are here for the Society of Thoracic Surgeons Congenital Heart Surgery Database User Group call for January the 12th, 2021. I hope you all have had a good holiday season and a happy new year. So I hope you're all ready to tackle 2021. For our agenda today, we'll have the standard welcome introductions, SPS updates, then we'll turn things over to Ikevia for their updates, and then we will turn things over to you all for your user feedback. On the call with me today from the SPS, we have myself, we have Carol Crone, we have Jane Hahn from the Ikevia team. Oh, we also have Addie Dolan, so don't want to forget Addie. From the Ikevia team, we have Jean, Jeanette, Rhonda, Joe, Melanie. I think that's what we have. And from core group representatives, we've got Janet, Janet Kreutzer, Leslie, and Chastity. Chastity, I think, will be joining us here shortly. First of all, for our SPS updates, I know the very first question, as you all know, the 2020 harvest deadline close date was scheduled for this Friday, the 15th. Just late breaking information. STS and Ikevia just met, and we have just recently, literally within the last hour, we've decided that we will be extending the congenital harvest deadline another week. So the harvest close date will be Friday, January the 22nd. At 11:59 p.m. Eastern time. That'll be the last time to get your file in. And official communication will be going out this afternoon to the CHSD community. That includes the primary contacts, your surgeons, backup contacts. All that information will be coming, that notification will be going out this afternoon. So we are working on that as we speak. The opt-out date is Tuesday, January 26th to opt out. And just a little bit of background for this extension. Ikevia has identified an issue with regarding missing pre-op factors and complications. They are actively working on the root cause of this issue, and we will have more information as soon as possible once Ikevia is able to give us an update. In the meantime, we do encourage you all to please use your internal quality checks. Check for missing pre-op factors and missing complications. As you're all aware, that missing pre-op factors is a risk model variable and is very important for your star ratings. So again, please continue to use your internal quality checks for those missing pre-op factors as well as complications. Also, Ikevia is going to be reaching out within, I believe, I don't think they've started reaching out, but they will be reaching out here starting shortly to individual participants that may be impacted with this issue. So please know that Ikevia will be reaching out to the primary data and file contact directly with additional information. So again, just please continue to use your internal quality check for that missing data. Again, we have extended that harvest deadline to Friday, January the 22nd. Next up, we have our 2021 harvest schedule. I know it's crazy to talk about the 2021 harvest schedule when we're still working on the 2020 harvest, but that harvest schedule has been posted and it is out on the STS website for your reference. I've included a link to that harvest schedule here on the slide. And these last few bullet points are just a refresher from our previous webinars, the SDS combination procedure codes. If you need a list of those that are currently being used in reporting, those are out on the SPS website. Also, just a friendly reminder regarding the Primary Procedure Mismatch Report. Please, before you use that report, again, just the important first step is to review the report overview that's located within the Ikevia library to understand its current functionality. So again, please be sure to have that handy when you are using that Primary Procedure Mismatch Report to understand its current functionality. And also just an update regarding the upgrade. We are continuing to move through the upgrade. We're still working through the intra-op section. Again, if you have any upgrade suggestions, please email them to me at ljones@sps.org. And just a reminder that we are scheduled to go live with the new version in January 2022. I've gotten several emails from some data managers with suggestions, so I appreciate those. Again, if you have any suggestions for the intra-op section and forward, again, please feel free to email those to me directly, and I can share those with the upgrade committee. Actually, right now, I just wanted to turn things over to Carol. I think Carol had some information that she wanted to share with the group. So, Carol?
Yeah. Thanks, Leanne. Hi, everybody. I hope you're having a good day. So the reason I wanted to have a little bit of time on today's call, because a few things have come up in both the upgrade process and in the transition to Ikevia that have made it clear to me that we have a lot of inconsistency in how we're capturing data and what sites are capturing and what sites are submitting to analysis. I want to take a few seconds to remind everybody that the purpose of the database is to improve the care of the patients that that the surgeons are performing the procedures on, which is the congenital group. For most of you, I'm sure most of you know that the history of congenital surgery is dependent. The progression of congenital surgery has been dependent on research that has come out of the STS database, and even prior to that, just research that has been done by our surgeons independently. With research, we need to have good data, clean data, and accurate data. What that means is that if we don't have consistency at sites who are submitting data, if we don't have consistency in understanding of the definitions, we don't have consistency in what's being submitted, or we don't have consistency in the cases that are being submitted, we have an issue with the research that can be done to improve the care of these patients. It has come to my attention that we really need to start focusing more on education, both in the training manual and during these calls with the educational part of these calls, to ensure that we are all on the same page. It's also important to note that you have a contract, your site has a contract with STS that states that you will be submitting complete data for any case that is entered into the database. My understanding is that some sites are choosing what goes in and what doesn't go in, and that's not appropriate. We need to make sure we're all on the same page, that we're all submitting complete data, and that we're all under the same understandings for definitions, and we're not to be interpreting those definitions as we want to apply them to our sites for our own site use. This is much bigger than any one site. This is about the care of congenital patients and progressing the care of those congenital heart surgery outcomes and improving that process for these patients and their families. So we are really dependent upon the work that goes in at the data manager side. It lies on your shoulders, and we have to use our database for the purposes, not just for internal at your site purposes, but for the larger congenital heart surgery community as a whole. We will be looking at the training manual and making some very good updates. I think you'll be pleased once you see the updates that are coming with the upgrade related to certain fields that have been pain points for sites. By removing those or changing the way we're collecting data, you'll also be pleased to see that we are going to work extensively on the training manual to help clarify confusion and definitions. But I ask and I plead with you to understand the importance of your job in collecting consistent and accurate and complete data, and how it impacts the care of patients, not just at your facility, but worldwide. So with that, it's kind of like my Jerry Maguire moment, because it was a little disheartening as we're going through the upgrade process to hear quite a bit that, oh, well, not all sites are doing that, or I can tell you, not all sites are doing it that way. And then to see when we're doing this transition with Ikevia that we have quite a few sites who are deciding that they don't want to enter incomplete data just because it doesn't affect their site. This is a whole big project. It's all of the sites nationwide and some sites international, I think, who are entering data into our database. And it's not just to get a star rating back and to show that you're a 3-star program. It's about improving the care of patients that are entrusted to you, as most of us are nurses, as either a nurse or some other type of medical provider, or some other type of person who's working at the hospital that is part of this. It's on our shoulders, and to make sure that we're doing the best job possible to get clean data in because of the impact it has on these pediatric children that we're serving. So I'm happy to answer any questions about that. I would be happy to also take feedback on the training manual and things like that. But just I implore you to please consider what you're entering into the database, to follow the rules of the data collection form, the training manual, to reach out if you have questions. Do not interpret things on your own to fit into your own site's definition. We have to be consistent, and I'm happy to facilitate improving that at all sites however we can. So thanks, Leanne. I just wanted to take a few moments. I appreciate it.
Oh, thank you, Carol. All right, next, I just wanted to give a friendly reminder regarding AQO. If anyone would like to purchase access to AQO from 2020, that is still online, and it's available for a year. So again, if you would like to purchase AQO online, the link is there at the bottom. The email address is there, so you can get information for that. Also, just a quick plug for STS annual meeting, which is coming up. I believe it's January 29th through the 31st. If your surgeons have not registered for the annual meeting, just a friendly reminder, just give them a friendly reminder to please get registered for annual meeting, as it is coming up very soon. Again, the annual meeting is scheduled for January 29th through the 31st. With that, I'm just going to turn things over to Ikevia now for their update. Ikevia, I think Joe's up this time.
Yep, it's me. Thank you very much. Good afternoon, everyone. Just going to run through a few updates here. Let me expand on that. Okay, starting with some items that were released last month on December 30th. For the data quality report, there were additional warning validation messages that were added to the DQR that will alert you to review specific procedures that make up combination procedures. And so those warning validations are listed below, the 2130, 1275, and 1125. And so with that, all combination procedure warning validation messages have now been added to the DQR. And do keep in mind that these are only warning messages, and they do not prevent any of your records from actually saving or being added to the database. So just keep that in mind, that it's not preventing anything should you encounter any of these warnings. Okay, then the missing variable report, a couple updates on that. The MVR was displaying a secondary or supplemental payer as a missing variable when the primary payer was either 13 or 14. And so that has been fixed. And then STS 4508, the MVR was displaying diagnosis and procedure as a missing variable when both missing and another variable were provided. So this was primarily for data that was migrated over from the DCRI system. We did have some situations where the missing checkbox was checked, as well as some other things, which was causing it to appear incorrectly as missing in the MVR. And so that has been fixed as well. All right, and then the next slide. A few updates that were made on January 5th last week. STS 5234, there was an issue where the uploader was displaying the submission status as canceled or failed, which was resulting in users not being able to submit records, and that was resolved on January 5th. Also on that day, 5317, the upload history submission cards were not loading in the uploader interface. And so we did make some improvements on performance in the back end that should have resolved that issue. So those upload history cards should appear in a more timely fashion now. And then STS 5201, there was an issue on the critical summary report where the total number of records was inflated and did not match the total number of records submitted in your DAT file, and that has been resolved as well. So the critical summary should now display the correct number of total records for you. All right, and then updates made just this last weekend on January 9th. STS 5048, sites were experiencing anesthesia variables on their missing variable report, displaying as missing, even though they do not participate in the anesthesia component. And so that has been fixed as of this past weekend. And then the dashboard report, there was an issue STS 4606, where the index procedures were not being correctly assigned or categorized correctly in the dashboard. And so those updates have been pushed live as well. All right, and then just some final notes. For one, if we didn't mention anything that you had reported during this overview, please do keep in mind that we are looking into your reported issues. And if you do need any updates or additional information, please follow up on those tickets, and the agent you're working with will get those updates for you. And also, we are still looking into items that will be released in future updates later this month. And once those have been identified, those will be posted to the notification section. And indeed, anything that I just discussed today should be in the notification section as well. All right, and that should do it for me.
Yep, great. Thank you, Joe.
Mhm.
All right, then the last slides are ones that you guys are very familiar with. I'm just going to quickly touch through the Ikevia Support Plan. You've all seen this before. And again, just my usual plea to please include your participant ID with your communications with STS and Ikevia. It just helps move things along a little bit quicker, and it just makes our lives a little bit easier as well. Again, just please include your participant ID with your communications with STS and Ikevia. Again, list of resources that are available to you on the STS website, phone support number, resource documents. Again, all of this can be found out on the STS website. Again, my contact information, which you all have, please feel free to reach out to me here via phone or email. Email is a lot easier to get in touch with me. If you have database operational questions, and this does include if your surgeons need assistance getting password reset, or their account's been deactivated, or they don't have access to the Ikevia platform, please email us at stsdb@sts.org, and we can assist with getting your surgeon set up. Our next, before we get into questions, I wanted to just remind everyone our next webinars, our monthly webinar is scheduled for January 19th at 12 p.m. Central, 1 p.m. Eastern. And our next user group call is scheduled for January 25th at 12 p.m. Central, 1 p.m. Eastern. Next, I don't have any further updates or information, so we'll turn things over to you all for your questions. I see quite a few questions coming in already, so if everyone's all set, then we will go ahead and start tackling your questions. So again, please feel free to put your questions in the Q&A, and we'll get to as many as we can during the next hour. We'll see. I'm going to put the webinar schedule.
This is Carol.
Yep.
I just wanted to add something into what I was saying. With the upgrade process, we are removing quite a few fields that I think the data managers will be really pleased about, and we'll be able to talk more about that when we get further down the upgrade process to show a more draft summary of what will be removed and the changes that are coming. In that, we'll also be working very hard on providing clarification in the training manual, and including diagrams and pictures, and making sure that areas where we have confusion, that it's spelled out, better. We will also be having upgrade webinars once this upgrade process is complete and we get the specs out to the vendors, which will probably start in probably July or August. We'll start these webinars, and I really encourage every person who abstracts data for congenital to join these upgrade webinars, because we'll walk through each variable. We'll talk about the changes. We'll walk through each variable, and we'll provide further discussion on the clarifications that were provided, or that will be provided in the training manual, which will come out at the end of this year after these webinars. So it's really important that when we start these webinars that folks join on, because I think we can probably clear up a lot of these clarification questions, or the questions that are having issues with those webinars. the main point of why I was bringing this up is because of the inconsistency of what sites are submitting, not just the definitions within the training manual, but more about what the sites are submitting. So, you know, we have some sites who don't submit any pre-op factors on op type 1 or op type 2 cases. And I totally understand that those are not analyzed cases. But if we ever go to analyze those or use those for research or whatever it may be, and we have 25% of the sites not submitting any pre-op factors on those cases, which are your risk factors, and then we're losing a quarter of our cohort. So it's your contract with STS says that you will be submitting complete data. It's important to submit complete data because we can't do anything with that data if you submit it and it's not complete. We lose it. So it's really about improving the care of the patients through the purpose of the database, which is quality improvement. And I'm not saying that our data is unclean or anything like that. I know we have a lot of work to do within the training manual, but what I'm saying is incomplete data is, no data is better than bad data. So if you're not going to submit complete data, it's considered bad data and we lose that and we can't do anything with it. And the patients lose out because you don't want to submit that data. So that's really the basis of why I was bringing this up. So thanks. Thank you.
Yeah, and I just wanted to clarify, Carol, I'm sorry. You had stated op types participants don't collect pre-op factors on op types 1 and 2. It's actually the other way around.
Yeah, I meant the other way around. Thank you.
Yep, so just wanted to clarify.
Not the op types 1 and 2 cases, on the other cases.
Yeah, correct.
Mm-hmm.
All right. Thank you so much. All right, let's see here. Let's go ahead and get into questions. Our first question, do I need to resubmit my 4-year data or just recent quarter? I haven't submitted since 2020. Did anything change? So Nancy, if you haven't gone back and changed or touched any of the data that was submitted previously, then you do not have to resubmit the entire 4 years. And again, that's just if you have not gone back and made any updates to any of that previously submitted data. But if you have, then you would need to resubmit that data that you have changed. But you do not have to submit 4 years of data every submission. So if you haven't done anything since the last quarter, then you just need to submit your recent quarter. So hopefully that answers your questions. Let's see here. Our next question from Kelly, if I remember correctly, the warning, the demographic data version does not match the data version of the form, will not affect our analysis at DCRI. I want to confirm that this is correct. That is correct. This is just, so if you have records, 341 records with a 3.0 data version, demographic data version, you do not have to update. It's not mandatory that you update that demographic record to 341. That's just an informational message letting you know that the demog data version does not match the data version of the operation record. And that's normal. That's fine. That's completely fine. Melanie, did you have anything to add regarding that?
Sorry, I was on mute. No, that's exactly it. And we actually had that question come through earlier, and that's correct.
All right, great. Thank you. Okay, from Heather, by missing pre-op factors and missing complications, does this mean that those data points are not migrating from the DAT file to the Ikevia system? So I don't know, Melanie, did you want to tackle this one since you're elbow deep in looking at the DAT file?
Elbow deep, yeah. Okay, yes. Yeah, and that's a great question just to get clarity there. So the current analysis of what we're seeing is that the DAT file does not contain the information. So we're still going through and reviewing more of those files, but in the current status of where we are, the issue seems to be that the information is not included within the DAT file.
Got it. All right, great. Thank you. And again, as we stated earlier, Ikevia will be reaching out to each of the individual sites. So stay tuned.
That's correct.
Yep. Let's see here from Jennifer. I have 3 cases showing up as critical errors because they say an anesthesiologist was present, but there is no anesthesia name because the anesthesiologists on those cases were general anesthesiologists and not cardiac. though they are not listed in my vendor list. What should I do about these? Should I say that an anesthesiologist was not present to get around this problem, as I want these cases included in analysis? I think, Janet, I think you've had this issue before, if I'm not mistaken. Is that correct?
I haven't had this issue, but if you don't have an anesthesiologist that has a business associate agreement with the STS, then you can get one on those other anesthesiologists and submit their data. So that's one option. But if you don't have one, then you can't submit their data.
Right.
So then you would just you wouldn't collect the data on that case, and you would put no, and the data that you were submitting to the anesthesia database would only have the data for your cardiac anesthesiologists. So those would be the two options that I would think would be the only way to get around it.
Okay. I agree. Thank you. All right. And I think we just answered this. Are the pre-op factors or complications missing in Ikevia? Yep. So we just, I think Melanie just addressed that question. From Carrie, is there a way to review pre-op factors and complications, not having to go into each procedure as a comparison through Ikevia as an overall picture? So you can look at your pre-op factors and complications in the dashboard. Mel, do you have any, or anyone from Ikevia have maybe understand this a little better?
Let me see. Each procedure as a comparison through Ikevia.
Yeah.
Maybe I'm stuck in regards to the wording in regards to as an overall picture.
Yeah. Carrie, if you could clarify that, we'll come back. If you could just clarify, we could try and get that answered for you. All right, and our next question is from Jennifer. A bunch of cases I submitted showed up on the mismatch report saying that I should choose an ASD procedure as primary, so I went and changed all of them. As I was about to go ask my surgeons about this today, I went to the interpretation guide to get more examples and found number 8 through 12 saying that ASD procedures should never be primary. This should apply to Ikevia's algorithm. Now I need to go and find all of those and switch them back. It's hard for me to answer this or to look into it because I don't know the specific circumstances and all the procedures that were entered for this operation. Jennifer, if you want to follow up and maybe provide some examples, we could work with you before you go back and change all of that again. We just want to let's just, if you can submit a ticket and then we could work with you to look at those before you go back and change everything again. Let's just talk through those, if you don't mind. Let's see, and then you have a follow-up. Then also, will Ikevia process them appropriately if they think the ASD should be primary? So just so you know, Ikevia will never change your data. When your data is coming in, they will just tell you what, give you the primary procedure you assigned versus what should be assigned based on the current rules. Ikevia will not change that. When the data goes over to analysis, DCRI will apply the rule as it should be according to, will apply the rules and analysis as they should be. No matter what you have assigned, DCRI will use the primary procedure that follows the rules as listed in the interpretation guide. I don't know if that, I hope that helped. If a fundamental diagnosis is missing, will the case be included in the DCRI analysis? McCall, I don't know the answer to that off the top of my head. I'll have to look into it and get back to you. So I don't know off the top of my head. But I will look into it and I will let you know. Let's see, our next question from Suzanne. Can someone remind me about the birth hospital Tntin Misting error? Is this an error that will affect analysis at all? So no, this is not, missing TIN will not impact your analysis. We're asking for participants to begin collecting TIN because moving forward, STS would like to be able to provide, reporting for other agencies, maybe CMS or anyone that may potentially want to use STS data for reimbursement purposes or anything in the future, we would like to have that information available to them. So we are asking congenital participants to start collecting that TIN data moving forward. Carol, did you have anything to add to that? I don't know if that was good enough.
Oh, yeah, I think you got it.
Okay, all right. Our next question, for 365-day follow-up, is this for patients for all 4 years or just 2019? So ideally, you should be collecting 365-day follow-up for all your patients.
You can't.
Oh, that's right. Sorry. Thank you, Janet. Yeah.
You can only collect it on 341.
That's right. Thank you. This is why I have you guys.
Leanne, I don't think the fundamental is required for analysis. At least it hasn't been in the past.
Yeah. Okay. Yeah, I was going to say I was going to have to. It should be outlined in the report overview. If you wanted to try and review there, but I'm happy to. I'll definitely look into that from the DCRI perspective to find out. But I agree with Janet. I don't think it's required to be included in analysis. So.
It's not one of those like 8 fields that you need. So
just primary diagnosis.
Right. Yeah, and all those required fields for analysis, again, they are outlined in that report. So if you just want to refer to that. Our next question from Peter, if we have an outstanding ticket and Ikevia team, he's got the ticket there, regarding a question on primary procedure mismatch and mortality, will that affect our submission for the harvest close if it remains unresolved?
This is Jeanette from Ikevia. So the information that's shown in the primary procedure mismatch report is, as Leanne's mentioned earlier, informational, and it would not affect your harvest analysis at all. The analysis itself will be run on the primary procedure algorithm and all that information. So it may assign a different primary procedure than you've chosen. If your ticket is related to a discrepancy on the mortality eligibility summary report, that is showing whether all of the required data points to make a mortality determination are present, and that if those variables are missing, could impact the way your record is processed for analysis. So we would certainly encourage you to review any discrepancies there, but we'll follow up on this ticket with the information you've provided here. I can't say for sure whether that question would impact the harvest data set, but we will follow up with you.
Thank you, Jeanette. Our next question from Amy is the next user group call on 125, which is a Monday, or 126. Thank you for pointing that out. So I do have a typo there, and I will correct this for when the slides are posted on the SPS website. The next user group call is scheduled for January 26th. That is on Tuesday, January 26th. So thank you, Amy, for letting me know. I appreciate that. And sorry for the typo. I'll get that corrected. Our next question from Dawn, TIN for surgeon. I did not listen carefully on last call and didn't understand fully that if surgeon TIN is not entered, this is a critical error and record will not be uploaded. How about records that have already been harvested uploaded? So TIN did not listen carefully on last call, didn't understand fully that it's surgeon TIN. So surgeon TIN moving forward, that's critical error, correct?
So that would be surgeon NPI?
Correct, surgeon NPI.
Surgeon TIN, yeah. TIN was not going to get a critical error.
That's correct.
Yeah. So yeah, so it will not impact your data getting uploaded or harvested or going into analysis. For our next from a call in the MBR, I get missing for prothrombin 4 in dose 3 when dose 2 is 0. Okay, McCall, I'm not sure if you've logged a ticket. I'm sure Ikevia will look into that and get back to you regarding that issue. So Carrie's saying complications grouped, Preop Factors grouped. I'm not sure, Carrie, I'm not sure I'm understanding. If you could just, if you would like to touch base with me offline, shoot me an email or just give me a call. We can, I can try and help you with that offline. I'm not understanding the question unless does anyone else on the team or on the call?
I think she's trying to ask if there's a way in Ikevia to see your overall complications by individual complications. So how many pneumothoraxes have you had over the 4-year period? And I don't think there's a way to look at that individually yet.
That's correct. There isn't a way as yet.
Great. Thank you,
Thanks for
Leslie.
clarifying that, Leslie.
Yeah, thank you. Yeah, there you go. Now I see your clarification, Carrie. Thank you. All right, so our next question from Elizabeth. So if we are not contacted by Ikevia for the missing pre-op factors and missing complications, can we assume that our site is not affected? Even if we are not contacted, would you recommend once this issue is resolved on Ikevia's end that we should rerun our file and resubmit? So, Ikevia, did you want to take this one, Melantine?
I can speak. Yeah, I can speak to it. So with this specific issue, like I said earlier, what we're seeing is that the information is not in the DAT file. So if that is the case, and we would then need to work with the vendors, because again, we haven't identified if it's one vendor or because we're still looking at analyzing the information. We would just make sure that the information is being pulled into the DAT file if it was entered into the software vendor system. So that's where we're at the moment. So in that instance, where we're able to validate that the information is in the software vendor system, we would make sure that the exported file contains the information related to those fields, and you would then need to upload those files so that the information can populate in the Ikevia platform. But if it's truly that the information is not in the software vendor system, and that information needs to be populated, then we need to make sure that, of course, the information is entered in the vendor system. And then we would make sure that, of course, we're able to guide you to upload those files into the Ikevia platform. So again, more information will be provided, and our support team will be reaching out to sites after we've identified and concluded with the root cause.
Thank you, Melanie. And this is a good point from Elizabeth. I thought STS is only concerned with the surgeon TIN and not the hospital birth TIN. That's correct. The hospital birth TIN, that's not the one that we are focusing on. Or, we're asking for you to collect that information, so you should, but we are really mainly focused on for that surgeon TIN moving forward. So in regards,
I think the previous, this is Carol, sorry, Leanne. I think the previous question was about the hospital birth TIN. So I think we may have caused a little. Just to clarify, it is the surgeon TIN that we're interested in. Sorry about that.
Sorry about that, guys. Thank you for pointing that out, Elizabeth. My organization is opting out of the current harvest. Do I need to resubmit the opt-out form with this extension? So no, if you've already submitted an opt-out form for the 2020 harvest, then no, you do not need to resend another opt-out form. So you're good to go. Can you please open up and let people ask their questions? It will be helpful. The only reason the only reason we're just not we're not opening up the phone lines today is just because it helps us to keep track of the questions when they're typed in this way. If there's anything, obviously, we need to open up and discuss, obviously we will, but this just helps us keep a track of all the questions that have been answered, and then I can get back to people accordingly. So that's the primary reason for that today. Our next question from Diane. Primary procedure mismatch. I too still have one case that's not been resolved. So, so Diane, if you do have a ticket in for that, Ikevia will follow up with you regarding that ticket. If you can, just put your ticket number in there. STS 5342. That's not a ticket number. So you would be looking for an RITM number that has been assigned to you. So if you could please enter that ticket number, and Ikevia could research for you. Surgeon TIN. Okay, yep, surgeon TIN. Okay. We can compare our vendor percent with Ikevia percent to see if it is crossing over in the DAT file. Okay, yeah, just again, for those missing pre-op factors and missing complications, again, just be sure to run your internal data quality checks to ensure that your records are not missing a pre-op factor or a or complication.
Hi, Leanne, it's Ruthie. Can I just give a clarification? Because this happened at my site. So just so people can kind of understand what happened. So when I was going through my missing variable report, the MVR, and we did our internal checks, we found that we were in fact missing pre-op factor data that was not in our software, was not in there. So of course it wouldn't be on the DAT file. So when we uploaded our DAT file and we looked on the MVR, there was nothing on the MVR showing that our pre-op factors were missing. So not until we did our own internal checks is when we figured out, hey, we haven't done the pre-op factors for these surgeries. So that's kind of where this all came about.
Yeah. Thank you for clarifying that, Ruthie. That's very helpful information, so I appreciate it. Let's see here. Is there a way to pull 30-day mortality and database discharge mortality by op type? I don't know, Ikevia, can you elaborate on that one? I'm trying to think off the top of my head the platform. I don't know if you guys are on mute.
We'd need to double check on this. If it was available, I think that the participant dashboard is the most likely way, but then that would be run per op type as you run the participant dashboard.
Yeah. Thank you, Jeanette. Our next question, is there any way we can look up TIN like we can for MPI? And I believe, Carol, correct me if I'm wrong, you should be able to check with your billing.
Usually it's the billing, or it's the number that the surgeons use to bill Medicare. So it's your billing office or your surgeon's office should have it. And I'm not sure if you can find it on.
It's not publicly accessible.
Mm-hmm.
Site and taxpayer identification numbers are not publicly searchable and published in the way that the National Provider ID list is.
Yeah.
But there are lists published out there to get them, because that's how I'm getting all the birth TINs. The hospital TINs. Well, and I guess that my surgeons bill under the hospital TIN, so.
Yeah. So you would just want to reach out, to your surgeon, and then obviously if he doesn't know, then go to billing and just backtrack that way. All right, does anyone have any additional questions or anything they would like to add? I don't know if anyone from the core group or anyone else has anything to add. Let's see here. I've got a couple things coming in. Here's a future suggestion from Angie to be able to have a report that bunches non-major complications and major complications. So thank you. That's a great suggestion, Angie. We'll add that to our list. Thank you. And then can someone please provide the link to that list of hospital TINs if there's one published out there? Yep, and that's Chastity. So everyone's asking for this.
Check the training manual, because I sent it in at the beginning of this version, and I think we published the link in the training manual.
Okay.
Correct. I was going to say, I got it from Leslie.
Great. So, and the training manual's out there. So, yep. Thank you. Heidi says thank you. You're welcome, Heidi. All right. So again, I don't have any other information. Again, just to clarify, regarding the slide that's on the screen, our next congenital user group call is January 26th, not the 25th. I will make that correction on these slides prior to getting them posted out on the website. Let's see, we have about 15 minutes left, so I'm still seeing a few more questions come in. We have a question from Liz. Can Ikevia allow for users to select all for non-index and index cases to view on the participant dashboard report?
That drop down is, I believe, actually indicating only show index procedures. Yes. And then if you say no, it would show all procedures. So if you pick no there, then that would give you what you're looking for, but that's a great question. And we may look at updating the report overview documentation to clarify that.
Thank you, Jeanette. Oh, sorry, my slides are going all crazy on me, so I apologize. All right, I don't see any additional questions. I'll give it just a few more seconds to see if anything comes in. I don't know if anyone from the team has anything they want to add. Again, just a reminder, the harvest is extended to Friday, January 22nd. Opt-out date is Tuesday, January the 26th. I don't have any further information. I'm not seeing any other additional questions come in, so I just want to be respectful of everyone's time. Again, if any of you have any questions or concerns, please feel free to reach out to me directly. You can reach me at ljones@sts.org. I am always here to listen, to talk. Just please feel free to reach out to me. With that, I'm not seeing anything else come in. If no one else has anything to add, I just want to thank you all for joining today. And I hope you all have a great rest of the week. So thank you, everyone.
Thanks, everybody.
Thank you.
Thanks, everyone. Thanks, everyone.
Thanks, CHSD and Ruthie for
Sure.
joining.
And Janet, yes, thank you all very much. I hope you guys
And
have a good
Janet.
rest of the week.
Thank you. Bye.
Everyone, bye-bye.